is Zoe Zhang.
And my name is Caitlin Chen, and this is our display board on nuclear medicine technologies, also shortened to NMT for convenience.
I chose NMT because I was interested in nuclear energy use in the medical field due to prior experience in researching it in a history project on the Non-Proliferation Treaty. It's a document between countries that describes the allowed uses and restrictions of nuclear energy use in exchange for information.
I chose nuclear medicine technologies because there's a social stigma about anything described as nuclear or radioactive, and these terms are often associated with cancer and danger. I want to stay away from the stigmas since nuclear medicine is an essential part of the healthcare industry, which has inspired me to research NMTs and the work that they do.
During research, I've learned what NMTs are. They are healthcare professionals that use radiopharmaceuticals and radioactive detecting machines to help make diagnosis. This image here is an example of what NMTs do, as they use machines like x-rays to take a picture of a patient's inner workings in order to help doctors and physicians make diagnosis on any potential diseases or injuries.
Specific job responsibilities include ensuring proper disposal of radioactive materials, educating patients on medical procedures, and measuring radiation dosage based on a physician's prescription. The average entry-level salary of an NMT living in the greater Seattle area is around $90,000 to $110,000. However, this salary can be increased or decreased based on location, any specialization such as CT or PET scanning, or global experience.
The education pathway in becoming an NMT begins in completing a high school diploma or the equivalent like a GED. Next, students must go to a college or university that has a accredited nuclear medicine technology program and choose to pursue between a bachelor's or a associate's degree. Afterwards, students must take a certification exam in order to become official NMTs. There are 2 of which in the US, each with their own eligibility requirement and fees, but students only have to take 1. The 4th step depends on the state that NMTs want to work in, as some states require licenses, and so students must take licensing exams in order to practice their degrees. In total, this whole process takes 2 to 4 years to complete and varies depending on the type of degree students take or the test dates of their exams. Some benefits in becoming NMTs are the flexibility in the types of work settings they want to work in. They may also feel a sense of fulfillment in helping patients. It's a secure job. However, NMTs may have some challenges like dealing or taking care of extremely ill patients, constantly updating their medical knowledge, and having to work with outdated equipment in certain areas. They may also have higher rates of radiation exposure due to the work that they surround themselves in.
One piece of information that stood out to me are how NMTs are able to lessen the risk of injury and illness. So NMTs keep records on how much radiation exposure they're exposed to for their whole lifetime. And these records ensure that dangerous levels of radiation exposure are prevented. For the creation of our display board, we use the contrasting colors yellow and purple for easier readability. And additionally, we avoided the color green because of a stigma associated with radioactive material. A model of an MRI scanner is in the center of the board, made out of popsicle sticks, to demonstrate how an MRI scanner works and how it looks like.
In the model, patients would lie on this bed, and then the bed would slide inside the MRI scanner and exit the other side. Since the patients have been injected with radiopharmaceuticals beforehand, the MRI scanner would scan for that substance and would depict an image of the patient's inner workings for a doctor or physician to analyze and diagnose. Thank you for listening.